Okay. I'm Corinne Freeman, and I'm going to be doing 3 skills in this video. I'm going to be doing a continuous IV to a saline lock, push medications through a saline lock, and discontinuing an IV. So first I'm going to do the converting the continuous IV to a saline lock. So I'm going to prepare everything according to the 6 rights of patient medication administration, which are right route, right dose, right time, right patient, right medication, and right documentation. Then I'm going to check the physician order and the MAR, make sure my order to change from continuous IV to a saline lock is in there. And then I'm going to identify my patient with 2 patient identifiers. So I'm going to use name and date of birth and the procedure. I'll have 3 just to be safe. Now I'll do hand hygiene and put on clean procedural gloves. Okay, next I'm going to loosen the tape. And first I would assess the IV and make sure it's still working, it's still in there. So then I'm going to loosen the tape so I can get to the IV. Take that off of there, and then I take off the dressing as well. So now my catheter, my IV catheter is exposed and I can get to it. So then I'm going to get my saline ready, and then I'm going to make sure that my tubing is clamped so it doesn't leak all over me. So my tubing is clamped. Okay, I've got everything I need. My tubing is clamped. Now I'm going to remove the tubing. Over there. Then I'm going to get a gauze pad. Not a gauze pad, I'm going to get a alcohol prep pad. And I'm going to clean the saline lock. And I'm going to clean around the site. Okay. Toss that. I'm going to get my saline. Oh Lord. There it is. Okay. You gotta cut everything up. Okay. Now I'm gonna get another alcohol prep pad. I'm gonna clean this just to be safe. I'll give this one another clean. And then I'm going to attach my saline. And then I'm going to slowly administer 5 milliliters of saline to flush out the IV. Cleanse him again. Okay. Now that's all done. I'm going to document everything and then I'm going to leave. Okay, I'm going to prepare and administer push medication through an IV saline lock because my patient is complaining of pain. So, first, I'm going to review my orders. So I have my orders right here, and they say to give Dilaudid 2 milligrams IVSP every 2 hours as needed for complaints of pain related to coughing. Dilaudid label states Dilaudid 2 milligrams per milliliter and dilute with 2 milliliter normal saline for IV administration. Give Dilaudid 1 milligram every 2 minutes per IVSP. So I'm going to give the medication 1 milligram every 2 minutes over a 4-minute period. Okay, so now that I got that, I am going to prepare everything according to the 6 rights of patient medication administration, and I'm going to also use the 3-check method. I've got my saline flushes ready, 5 milliliters for before and after. So now I need to prepare the medication, and according to my orders, I need 2 milliliters of normal saline diluent. So I'm going to perform hand hygiene and put on some clean gloves. This is going to be my diluent, and this is going to be my medication. So I'm going to get an alcohol prep pad. And clean the tops of both. And then get my needle and my syringe. Okay, well this needle seems to be bent, so we don't want to use that. So we're going to take that off and put it in a sharps container. We're going to get a different needle, put that on there. Okay, so I'm using a 3 milliliter syringe, and I need 2 milliliters of diluent. So I'm going to take the cap off of my needle and draw up 2 milliliters of air. Inject the air into my diluent. Bring up 2 milliliters of diluent and inject that into my medication. Then I'm going to recap my needle using this technique so that I can throw it away. Don't come for me, it says it right in the thing. And then I'm going to throw away my needles in a sharp container, keep the syringe. Okay, now that my medication is ready, I'm going to take these gloves off, do hand hygiene, and put new gloves on. Then I'm going to assess the IV, make sure that it's still able to work, it's still functioning properly. Then I'm going to get another alcohol prep pad. I'm going to clean the saline lock, and I'm going to get my saline. I'm going to clean that, and I'm going to attach. And I'm going to do 5 milliliters of saline flush. Slowly. Okay. Disconnect him, put him over here. Then, I'm going to get another alcohol prep pad. Clean the saline lock again. Then I'm going to get my needle, a new needle and a new syringe. Cap this bad boy. I'm doing 1 milligram every 2 minutes. So I'm going to pull up 1 milligram. Inject that into my medication. Inject the air. Pull up 1 milligram. Pull that over there. Take off my needle. Clean this. And I'm going to place the saline, and then I'm going to slowly inject it. Like I said, I'm going to give 1 milligram every 2 minutes over 4-minute periods. I'm going to slowly inject that. I'm going to take this off, throw that away in a sharps container, get another alcohol prep pad, clean this bad boy, make sure that the patient tolerated the procedure well, that they're not having any adverse reactions to the pain medication, and that they don't need anything else. And then I'm going to take those gloves off. Hand hygiene, I'm going to put a new pair of gloves on. And I already cleaned that. I'm going to get a new thing of syringe. Clean him. I'm going to clean this again just to be safe. You can never be too safe. Attach the saline. And do another 5 milliliters of flush slowly. Take that off. Get another alcohol prep pad. Clean him again. Then I'm going to get rid of all this stuff. Get rid of all my equipment. Document everything. Leave the patient in a comfortable, safe position. And I will assess them later to make sure that the pain medication actually worked for them, that they're not having any adverse reactions, and that they're no longer in pain. Okay, gave my patient her IV push medications. She's feeling better and she is going to go home. So I'm gonna get gauze. I need another gauze. I'm gonna get 2 gauzes, and then I'm gonna get clean gloves, and I'm gonna need some tape. So I'm gonna do hand hygiene and put some clean gloves on. Then I'm going to take the tape off. And then I'm going to get a gauze pack. And I'm going to hold this and I'm going to slowly release the catheter. And I won't put any pressure on it while I'm trying to remove the catheter. Once I have it out, I'm going to immediately apply pressure, throw him away, and I'm going to hold it there for 2 to 3 minutes or until the patient stops bleeding. And then once I think they've stopped bleeding, I'm going to look at it, observe it, make sure they're good to go. If everything is okay, then I'll get another gauze pad and I'll fold it so that it can put pressure. I'll put some tape. And I'll tape that onto there. And then I will make sure the patient doesn't have any questions for me, document everything, and